Hi everyone, it's Paul. This specimen is an endobronchial ultrasound-guided transbronch FNA. It's of the 7L, 7R nodes. Clinical notes were metastatic colorectal cancer, large left hilar mass and mediastinal lymphadenopathy, and it looked necrotic on CT. So that's the subcarinal lymph nodes. So what's your diagnosis? So the specimen, not surprisingly, had a very dirty look to it. There was lots of debris present, and the air-dried specimens especially had a very messy look to them. There were some ciliated bronchial epithelial cells around, and there's a lot of degenerating cells, quite hard to make out on the diff-quecks. There was definitely a population of abnormal looking cells, however, and on the PAPs there was some well-preserved malignant cells. These were mostly in groups that were quite disrupted. There were no great glandular arrangements, acinar or things, but there was possibly some areas where there were some small columnar strips of cells. The nuclei were hyperchromatic. They had kind of coarse chromatin that was irregularly distributed, and there was moderate anisokaryosis. There were small nucleoli present in most of the nuclei. There were some elongate, like more columnar looking cells around, especially singly, but there was also bronchial epithelial cells as well, so it's a little hard to say that they were definitely the malignant cells. But I think maybe some of the groups showed some columnar morphology. So in summary, this really looked like a poorly differentiated adenocarcinoma. The extensive necrosis certainly fitted with a colorectal primary. The specimen didn't really have the tall columnar obvious glandular cells that you often see in that sort of findings. It looked more poorly differentiated. But I think there were maybe some palisading strips and eccentric nuclei. We did a cell block. A lot of it looked fairly necrotic, as you can see, but I think there were some little strips of columnar looking cells in places. Did some IHC, the cytokeratin 7 was negative, just showing you the CK20, which is positive. Also the CDX2 showed nice positive nuclear staining. and this is a CD10, a marker that's overexpressed in advanced colorectal carcinomas. So in summary, this specimen showed nice correlation with the radiology and with the clinical history and looked consistent with the metastasis from a colorectal carcinoma. So I hope you enjoyed that case. Thanks for watching.